I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country. It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
Americans were told there was no concern. Ebola, as dangerous as it was, as lethal as it is, might make landfall here, but everything would be under control. Ebola's now here, officially, and it could be just a beachfront in what is the war on an incurable virus. Time to separate the hype from the facts. Welcome to Midpoint. Professor of Epidemiology at Columbia University's Mailman School of Public Health and Chair of the Columbia Institutional Biosafety Committee, Dr. Stephen Morse, and the Associate Professor of Biological Services at Purdue University, Professor David Sanders. Gentlemen, I thank you both for being here today.
Glad to be with you.
Dr. Morse, I'm going to start with you. There is now a report that the Dallas hospital did not ask about the travel history of the individual involved. They did not get any sort of idea where he was. He, of course, did not offer where he had come from. So they let him go basically at that point with nothing more than antibiotics and turned him loose. That's frightening to Americans right off the bat. It says that indeed we may not be ready to see what is in these patients, what their symptoms might be, and we might actually let something out there that we could have stopped.
I think there's still education to be done here. We always used to say that it all begins with an observation by an astute clinician, and in this case, obviously, it was a very hurried clinician who wasn't thinking about Ebola as a possibility, which surprises me considering how much attention we've been giving to this possibility. So I think for about a 3-day period, when he was sent home, he might have been able to come in contact with others and infect others. Ultimately, he came back and the right thing was done. But I think it reminds us that everybody really has to be asking these questions when they see a patient, even if it just looks like the flu. Where have you been lately?
Professor Sanders, let me get to you. How worried are you now that we use the phrase here, a hurried clinician, and perhaps not being schooled enough to be able to see something and maybe even think about the possibility, though it certainly wouldn't be at the forefront of someone's medical thinking?
I think it's important that we have a heightened consciousness now about these issues, and I think that the fact that we have a case here in the United States will heighten that consciousness. So I think it is important that if you have the symptoms associated with Ebola, that clinicians, physicians, do ask you about your travel history and so on. I think travel history in general is a very useful tool to physicians, and it should be included as a part of a checkup, as a part of a contact with a patient.
Let's be fair. These clinicians face an awful lot of pressure. They sometimes face an awful lot of people who walk in and out of emergency rooms. But Professor Sanders, do we need to put the word lazy on this? Because simply put, we've known about Ebola coming in here, and seeing somebody from another country should immediately raise a red flag.
Again, as I said, I think it should be standard practice that one asks about travel history because that would widen the scope of the possible diseases that could be associated with the symptoms. But I wouldn't necessarily say it is laziness. Physicians see lots of patients, and that isn't necessarily at the forefront of their consciousness. I believe that this case will bring it forward, and these things are a process of learning. We have learned about this, and I think that's going to help in the future.
Professor Sanders, I know you're only with us here for a few more moments. Dr. Morse, I'll ask you to stand by a moment because we are going to take a break, and you're going to stay with us. But about the minute I have left here, Professor Sanders, in your opinion, are United States hospitals and United States clinicians here prepared to deal with what might be a breakout virus and invasion, or virus, if you will?
I would say that physicians at the larger hospitals in this country are and should be prepared, and that we're going to have to consider the fact that not every single hospital in this country is necessarily prepared, but that people at those hospitals should be aware enough that they have to bring in people from the larger hospitals and potentially transport patients to those larger hospitals in order that will have sufficient containment facilities.
It is at the smaller hospitals, indeed. Professor Sanders, again, as I noted, you're only with us here for a few moments. I thank you for being here. Dr. Morse, please stand by because we're going to come right back to you. After the break, what can be done to bring Ebola to its knees at the source? And can anything really stop it from going worldwide? And later this hour, the man who claims he can make America whole if only the president would let him help. Heaven help us all. That's coming up right here on Midpoint.